What is a vampire facelift and what does it do? Is it worth it?
Thank you for your question. You submitted your question without a photo, and you're asking a basically straightforward question. What is a vampire facelift, and is it worth it? Well, I can certainly understand why you're asking this question. I can understand why there is confusion. A little bit of background. I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. I've been an active member of the Vampire Facelift Network and have been a resource for the media periodically whenever the vampire facelift is featured in different media outlets. So I think there's basically a lot of confusion because of the incredible popularity of the term, as well as the frequent misuse of the term, as well as physicians being inaccurate and often dismissive of the term as it relates to the elements associated. So to begin with, the vampire facelift is a very specific procedure, and it was created by Dr. Charles Runels, and it was created many years ago, and it seemed to have a remarkable impact in popular culture, such that the term actually outranked the term Botox in terms of popularity in search. So ultimately, it also led to the proliferation of a lot of articles about things involving blood, and that's where the vampire concept comes from. The term vampire facelift basically is distilled into a combination approach to helping with facial aging or facial volume enhancement. The vampire part, again, I talked about blood. It has to do with something called PRP, platelet-rich plasma. Platelet-rich plasma is derived from your blood, and when it is placed under the skin as an injection, it stimulates the fat cells, stimulates the blood supply, and it creates this nice glow to the skin. So the term vampire and blood, you can see the relationship there. The other part of this procedure, the term facelift, which is really not a surgical facelift by any stretch, but as Dr. Runels envisioned it, he saw it as volume resulting in lifting of the skin away from the underlying structure. And this is based on a simple principle. As we get older, we lose facial volume. We lose bone, muscle, fat, soft tissue. So Dr. Runels' idea was you take somebody who is not really a candidate for a surgical facelift, who has typically a relatively thinner face, and you place one syringe, which is 1 cc, of the hyaluronic acid filler of your choice to add volume in areas that are up to the choice of the physician performing the procedure. So there is the benefit of the filler placed, let's say, under the eyebrow, in the tear trough, in the cheeks, around the lips, in the corners of the mouth. Basically, of course, one syringe. In addition, injecting platelet-rich plasma to help improve the skin quality and glow. Now, that being said, a lot of times people interpret vampire facelift to mean only PRP. A lot of doctors who are not part of the network will claim to be doing it and will represent it in a way that's not accurate. And so it's understandable that by strict definition, that is what is the vampire facelift. Now, that being said, you can decide by meeting with a doctor who is on the Vampire Facelift Network to see whether or not you're a good candidate. I think one of the things that we observe in our practice is that patients will come for a vampire facelift consultation and assume that it's only PRP or platelet-rich plasma. Very often these same patients need a lot more filler than 1 cc, or are actually better candidates for other procedures, whether it's surgical facelift, whether it's lasers, whether it's a combination. So in terms of is it worth it? It is worth it if you are the right candidate. I have found, certainly over the many years of being part of this network and seeing patients in consultation for facial aging, which is a focus of my practice, that people often want to get the most out of the least, naturally. However, when we think about volume loss in the face, we have to think of options beyond just the strict definition of the vampire facelift. So for example, patients will come in and will recommend maybe doing several syringes for different areas of the face of hyaluronic acid filler, and will combine that with PRP. One modality complements the other. The hyaluronic acid filler complements the PRP, and in areas where they're actually mixed together or where they overlap, there's actually a synergy in the combination of the stem cell activity benefit of PRP synergizing with the matrix of the hyaluronic acid filler, which is scientifically fascinating. So I think that it's important that if you are considering this procedure, that you find a doctor on the Vampire Facelift Network and get a proper evaluation. You don't just assume that you're going to get that procedure by booking the appointment, but at least get a proper evaluation so you understand what the outcome will be. There always has to be good communication about what the results will be on any treatment, whether it's this or any other aesthetic procedure. So I hope that was helpful. I wish you the best of luck. Thank you for your question.